Good evening. I'd like to welcome everybody to the public hearing for our Human Services Block Grant for the upcoming fiscal year. With me today, I have our Human Services Director, Ms. Angelique Hires. I have our Mental Health and Intellectual Disabilities Administrator, Ms. Janet Dreitlein. I have our Chief Financial Officer, Mr. Gastón Gonzalez. I have our Administrator of Adult and Family Services, Ms. Jessica Fink. I have our Deputy Administrator for Early Intervention and Intellectual Disabilities, Ms. Alicia Redden-Ravel, and I have Dana Rachko, our Deputy Administrator, for Drug and Alcohol for the county. This is our annual meeting to discuss our plans and what we've accomplished in the past fiscal year and what we look to do in the future. So with that, I will turn it over to Ms. Hires to talk about our mission statements.
Hello, I'm Angelique Hires, the Human Services Director for Delaware County. And the Human Service mission statement is, Delaware County Human Services is committed to addressing the social service needs of county residents in an inclusive and equitable manner with a holistic, trauma-informed, culturally competent, fiscally responsible approach designed to meet the statutory mandates of the respective program offices. And Human Services, we also have a racial equity statement, and our statement reads, the Delaware County Department of Human Services acknowledges and understands historical and ongoing systematic racism exists in our work environment. Racialized practices and behaviors which result in disparities and inequities within our department will not be allowed to continue and must change. The department's goal is to create an organizational culture of inclusion and equitable success where the unique voices of all are valued, thereby bringing demonstrated diversity and creativity to our workplace and services provided. I'm going to pass this to Jessica Fink, our Adult and Family Services Administrator.
Good evening. Our mission and vision statements are, Adult and Family Services oversees a wide range of community services to families and adults in Delaware County. Our responsibilities include oversight of contracted services under the continuum of care for homeless programs, including homeless prevention, emergency shelter, and permanent housing. Adult and Family Service also provides contractual oversight for food assistance programs, medical assistance, transportation, and a variety of other supportive services. Adult and Family Services supports agencies through ongoing education and the provision of tools to ensure equity in their services and to assist families and adults in leading safe, healthy, and productive lives and break the cycle of homelessness. Families and adults will receive equitable, trauma-informed, and outcome-focused services from provider agencies.
Good evening. The Drug and Alcohol Mission and Vision Statement is, the mission of the Delaware County Single County Authority is to assure the provision of a comprehensive array of quality alcohol and other drug services for eligible children and adults that will assist them to maximize their human potential. The Office of Drug and Alcohol is an administrative office that oversees the delivery of treatment and prevention services in Delaware County. The Division of Drug and Alcohol Programs provides funding for prevention, intervention, and treatment services to all eligible Delaware County children, adults, and families.
The Intellectual and Developmental Disabilities Mission and Vision Statement. The mission of the Delaware County Office of Intellectual and Developmental Disabilities is to advance the health, welfare rights, independence, and community inclusion of children, adults with intellectual and developmental disabilities, and/or autism spectrum disorders in Delaware County. We envision a community that includes people with intellectual and developmental disabilities and/or autism spectrum disorder as full members of the society who self-determine to the greatest extent possible, visualize fulfilling lives, utilize natural and paid supports as necessary as a part of a meaningful life.
Good evening. The Delaware County Department of Human Services Mental Health Office's mission is to assure the provision of a comprehensive array of quality mental health services and supports for eligible adults and children that will assist participants in maximizing autonomy, independence, and self-determination. We do this by collaborating with many adults, families, systems, and providers as possible to identify individuals who are in need of mental health services. We strive to educate all of our stakeholders and our system partners regarding the need for and delivery of culturally competent, trauma-informed, and evidence-based services.
Human Services Block Grant Planning, was initiated in fiscal year 2012 through 2013 with Act 80. Delaware County is among the 20 pilot counties, and we combine funding for all overall human service plan. The category of programs included are mental health, intellectual and developmental disabilities, drug and alcohol, adult and family services. On the planning team, we have we always call her Sandy, sorry about that. Sandra Garrison, Chief of Human Services and Community Services, myself, Angelique Hires, Human Service Director, Gaston Gonzalez, our Chief Financial Officer of Human Services, Janet Drakeland, Mental Health and IDD Administrator, Donna Holliday, our Mental Health Deputy Administrator, Alicia Redden-Ravel, our OIDD Deputy Administrator, Pam Bell, our Drug and Alcohol Administrator, Dana Ranko, our Drug and Alcohol Assistant Administrator, Jessica Fink, Adult and Family Services Administrator, Samantha Schrockbein, our Fiscal Officer 1 for Human Services, Vandy Moseray, the Fiscal Officer for Human Services, Warner Williams, Fiscal Officer 2 for Human Services, Mental Health, IDD, and DNA Advisory Boards. Our stakeholders include Children's Cabinet and Coalition, Mental Health IDD Advisory Board, DNA Planning Council, the Delaware County Advocacy and Resource Organization, NAMI, Voice and Vision, Partners for Success Coalition, police departments, Delaware County Treatment Court teams, Delaware County Anti-Trafficking Coalition, AFS, DNA, IDD, and mental health providers, community support programs, Compeer, Homeless Services Coalition, Community Care, Behavioral Health, Employment Forum, Delco Collaboration, ODP and AMSAS, Field Offices, Springfield Cares Coalition, OIDD, Families with Participant-Directed Services, and District Justices, Delaware County, and also Delaware County School Administrators. I'm going to pass this on to Sandy Garrison to give us an overview and of our past year.
So the block grant, one of the beautiful things about it is its flexibility. It used to be that each of the services got an allocation. If those funds were unspent in a year, they'd go back to the state. If programs needed additional funds and there weren't funds available, then we wouldn't be able to continue to provide the services. Since the initiation of the block grant, we've been able to do some great things. We used to have to close our drug and alcohol system, meaning at a certain point during the year, our funding would run out and we could not provide services for individuals that did not have insurance or other means of funding their treatment. Since the initiation of the block grant, we have not had to shut the drug and alcohol system down. Additionally, we've had over the past several years, an increase in individuals receiving services for intellectual and developmental disabilities. Had the original allocation been in effect, we wouldn't be able to provide those services, but with this block grant, we're able to shift the funds when it was needed to the intellectual and developmental disabilities program. We've also been able to shift funding to the homeless services. There's been times, or actually before the block grant, there were significant cuts to the Human Services Development Fund, which is one of the funding streams that would assist the unhoused population in our county. So we were able to shift funds to help that program out. So again, the thing with the block grant that's great is we can move funding between the different categoricals as the needs in our county change. The other thing that's been very helpful for us with the county is we're allowed to retain up to 5% of the block grant that's unspent in any given year. So if we have funding that we didn't utilize, instead of it being returned to the state, we can keep it and use it for programs within the county that we feel are appropriate or needed at that time. With that, we've been able to do homeless case management. We've been able to increase funding to our shelter services, provide rental assistance, and also more recently, with the COVID pandemic, we've been able to provide funding to our providers so they could give incentives and retention and recruitment bonuses to their staff because, as we all know, staffing has been a huge issue across all the human services funding or programs, with not only with just in the county, but everywhere. With that, I'll turn it back over to Ms. Hires.
I just want to go over what the Human Services Administration accomplishments have been for the last year, and then we'll share that across programs. We have successfully transitioned to a new behavioral health managed care organization, and we also enhanced our partnership with the county's criminal justice system in an effort to prioritize treatment and reduce incarceration and detention. We've partnered with community organizations to ensure county residents have equitable access to key programs and address barriers to services. We've continued Healthy Kids, Healthy Schools initiatives in conjunction with the District Attorney's Office. We've distributed and posted service maps for all human services programs, and also our No Wrong Door activities have increased access to social determinants of health, like food, shelter, childcare, and treatment, which help to divert individuals from poverty, criminal justice system, and high levels of care by collaborating with various county offices, township boroughs, community partners to provide an overview of human services programs and resources. I'm going to pass it on to Jessica Fink to go over the accomplishments for adult and family services.
So in Adult and Family Services, we were able to create a new partnership with Human Good to provide us with 6 housing slots for homeless or near homeless adults, 62 years of older and older at Grace Court. We were able to establish Breaking Bread Community, that is an Upper Darby shelter that serves 17 single adults. To date, from December 21st, 2022, when it opened, until June 30th, they were able to serve 55 unduplicated adults. 15 of those were 61 years or older. We've increased collaboration between the shelters and Project Share to provide life skills groups and treatment services to, again, the shelter residents. And lastly, St. Joe's Family Hope Center, which was formerly Family Promise, contracted with us this year to serve 18 people. It is families that they serve, but they can only serve up to 18 people at any given time. Over a 2-year period, 46 emergency housing vouchers were distributed through the Delaware County Housing Authority to domestic violence survivors, persons in shelter, and rapid rehousing programs that enabled us to serve additional people. Delaware County Housing Authority provided us with 32 mainstream vouchers for homeless persons with disabilities verified by the Social Security Administration. We have created a training committee comprised of COC, which is Continuum of Care providers, and community stakeholders to develop a core training curriculum for all homeless services providers. And lastly, successful application for a Home for Good funds enabled us to provide furniture, rent assistance, SEPTA passes, and additional temporary emergency shelter to those in need.
Drug and alcohol had several accomplishments this year, but the most notable do include the support of MVP Recovery to expand their services from Recovery House and outpatient services to now offering screening and assessment services at 2 locations, as well as the Warm Handoff Certified Recovery Specialist program, which helps individuals who have overdosed or individuals in the community who have a substance use disorder and would like help from a peer specialist. The Single County Authority helped to house 30 individuals who have a opioid use disorder or stimulant use disorder through our Finally Home program. Finally Home is designed to assist individuals who have a substance use disorder by helping them pay their first 6 months of rent and also offering housing-focused case management services. And that's offered through Community Action Agency of Delaware County. We expanded our anchor providers, which is our screening and assessment sites, how residents of Delaware County are able to access drug and alcohol funded treatment through the Single County Authority. We expanded that to 7 locations instead of 5. The Office of Drug and Alcohol Prevention staff to work with our contracted prevention providers to increase our strategic prevention framework, including our state prevention plans. Our prevention providers were able to add gender-affirming and culturally appropriate services that will be presented in the schools to middle school and high schoolers, and those are evidence-based programs. They also offered a successful training series with topics that included race and substance use, gender and substance use, poverty and substance use, and disabilities and substance use to a variety of different venues. The Single County Authority was also awarded a $3 million grant through the Pennsylvania Department of Drug and Alcohol Programs for a crisis stabilization center, which will be located in Delaware County and will help to provide access to screening and assessment for both drug and alcohol and mental health, and coordination and referral to services including medicated assisted treatment and engagement with certified recovery specialists. Lastly, with the closure of a major hospital system within the county, the Single County Authority did not halt our services, but we rather expanded our network to keep providing services to our residents.
Intellectual and developmental disabilities accomplishments. We initiated a cross-system collaborative team to support individuals who are involved in multi-systems. We were recognized at the Everyday Lives ceremony for our outreach and community engagement by the intake unit. We achieved our quality management goal of reducing restraints for individuals that are supported in our programs. Independent monitoring for quality review of 180 individuals reported no immediate health and safety priority concerns. We added incident management position to our administrative entity, which allowed the office to complete an additional 107 investigations this year and maintain compliance with the Office of Developmental Programs to meet timelines. Conducted monthly monitorings for new prospective providers to discuss life sharing and services. Enrolled individuals into the life sharing program and successfully supported the transition of individuals into the community from the prison system.
Our mental health accomplishments for the previous year that started with the development of the Delco Connect program to provide support to families that are waiting for services. To develop the development of a process to go live with our multi-system youth pilot program with Georgetown University and the Stone Lee Foundation. We became one of only 4 Pennsylvania counties to secure a 4-year system of care grant. We were able to operationalize a mobile crisis with law enforcement program through a congressional directive spending award to the Delaware County. The initiative involves a coordination between Human Services, the district attorney, emergency services, and local law enforcement. With that program, we have 2 teams that are allocated to Upper Darby and Havertown Police Departments for to be sent out if there are issues related to mental illness that the police have identified. They can call those 2 specific teams, and they can come out and assist the person either to get them connected to services, or if needed, to take them to the hospital, take them to Crozier, to our crisis center for evaluation. So that is a direction that we're happy to start going in this county. We have secured $2 million in a community hospital integration program for our forensic center to support diversion and step down from our prison, and also for mobile restoration of competency program. Those 2 programs, the mobile restoration of competency program will allow for people to be released from prison when appropriate and receive that support in the community to restore their competency to be able to stand trial. Additionally, the forensic center will allow individuals that are not appropriate or not eligible to be to move into the Norristown State Hospital, to be diverted from prison, or to step down from prison or step down from Norristown, and have an opportunity to be connected to services in the community. We have worked with our criminal justice partners to improve collaboration for those individuals who are reentering the community. That has been a huge opportunity for people that need support when they're coming out of the prison into the community. We've worked with the Court and Community Connections Administrator and the District Attorney's Office to move forward the Healthy Kids, Healthy School initiative. We've secured a grant for $250,000 from the Office of Mental Health and Substance Abuse Services to evaluate our county crisis services and bring them in line with the Substance Abuse and Mental Health Services Administration Crisis Toolkit. We are going to be able to evaluate what we're doing here in Delaware County, and then be able to identify where gaps in services are, and be able to take the toolkit that SAMHSA has provided and make sure that we are in line with that, which is the direction that the state of Pennsylvania is going in all of its counties.
Fiscal year 23-24, goals and initiative.
The Human Services Administration goals and initiatives are to commence transition from civil service and increase our staff retention. Also, we're looking to evaluate our providers and our programmatic policies on a comprehensive basis with the Statistics, Data, and Quality Unit to ensure that decision-making is data-driven. We're collaborating with executive leadership and quality teams to develop the first annual the Department of Human Services Integrated Quality Improvement Work Plan and Annual Evaluation. We're going to expand our Department of Human Services internal quality management capacity by increasing quality staff with a focus on efficiencies, increased data collection, and standardization of our procedures. We're also increasing our outreach by increasing the outreach hours in our county offices, libraries, community providers, which will offer time for residents to learn more about our human services programs, as well as be immediately linked to these programs. And finally, we're going to research and develop enhanced forensic infrastructure to decrease recidivism and increase community tenure and access to social determinants of health, especially in the areas of transitional housing and programming for special populations. I'm going to pass it to Jessica Fink.
So the things that we would like to do this year include identify and activate a new outreach team to provide new outreach services to the unsheltered residents of Delaware County. We are in the process of an application for an expansion of our coordinated entry services to include a 24-hour access point. Our shared food program is in the process of renovating a warehouse in Delaware County to be the first Delaware County food bank. We are exploring funding opportunities to bring back our SOAR program, which would enable us to help residents who are disabled to get their Social Security benefits more expeditiously. We'd like to reduce the number of households who become homeless and reduce the length of time they remain homeless as compared to the previous year. That's always a goal. Transition households from emergency shelter or rapid rehousing into permanent housing whenever possible. We'd like to reinstate our shelter space to pre-pandemic occupancy rates due to the need to distance people. We had to reduce our shelter capacity. And lastly, increase and secure ongoing forensic funding so we can continue to provide bridge funding for housing, food, transportation, ID, clothing, and other social determinants of health, which help to increase community tenure and well-being of those returning to the community from prison or a regional forensic center.
Drug and alcohol goals and initiatives for this fiscal year include continue working on transportation needs throughout the county, which would include offering funding for third-party rideshare apps and also promoting the county's contingency fund, which can offer funding for transportation. Promoting SCA-funded services in a meaningful way so that residents and stakeholders see the single county authority as a resource for prevention and treatment services. This also includes translating our brochures and documents into the 3 most commonly used languages within Delaware County. We would like to continue to enhance our collaboration between various providers and stakeholders, including the newly established health department, more so helping with our policies concerning communicable disease. Our in-county contracted treatment and prevention providers will meet for the first time together in a joint provider meeting to discuss different programming, so again, we can enhance collaboration between treatment and prevention services. To complete a list of substance-free activities offered throughout Delaware County and make that accessible to the community. This would be reaching out to businesses like outdoor activities, music schools, and things of that nature to see if they can offer lessons or classes at a free or discounted rates for individuals in recovery. The Single County Authority will coordinate and sponsor social wellness events for free through partnerships through our contracted recovery houses. These events will include a softball tournament, an outdoor hike at Ridley Creek State Park, partnering with a local animal shelter to rescue dogs, and a movie event. These events will be open to the community but are focused on individuals in recovery. Lastly, we want to engage hospital and emergency room staff to increase the utilization of our Certified Recovery Specialist Warm Handoff program to serve individuals surviving overdoses and those with substance use disorder who present in the physical health system.
Intellectual and developmental disabilities, goals and initiatives. To continue to enhance the multi-system cross-collaborative team, to review, plan, and coordinate levels of care for transitional age youth and adults, share and provide opportunities to discuss the benefits of life sharing and supported living for individuals exploring residential supports, to provide opportunities for individuals to connect with community partners in order to engage in meaningful day activities, supported in competitive employment, community participant supports, and also any other type of meaningful day activities. Explore data to review access and utilization of services as it relates to racial disparities. To continue to provide education and support to individuals, families, school partners as they transition from the education system to the adult system. Support individuals to have an everyday life by utilizing the tools from the Life Course framework. To expand our current dual diagnosed treatment team to support our individuals living in the community.
Our mental health goals and objectives include to commence the assessment of the crisis services and development of a plan to address service gaps and bring Delaware County's crisis services in line with Substance Abuse and Mental Health Services Administration Crisis Toolkit. We are hoping to be able to open our transitional age youth residential facility and also to open a forensic long-term structured residence. These are 2 residences that will provide us with additional opportunities for people to step down from higher levels of care and become more in the community, and also to learn additional skills so that they can even step down further to other types of programs. We're hoping to open an on-site crisis center and base services unit on the eastern end of the county. We're hoping to implement the Our Hair initiative, which works with our communities of color to raise both prevention awareness and the availability of services to assist our county work toward the unique programming to equitably address the needs of all community members. This is a program that our managed care organization, Community Care Behavioral Health, has developed and utilized in other parts of the state that has been very successful in helping, in assisting people, communities of color, to increase their utilization of the services in the community. We are hoping to implement a warm handoff program in the emergency departments that mirrors the warm handoff that the drug and alcohol programs already have, so that we can work with those programs to address both the drug and alcohol and the mental health needs of individuals that present at emergency departments. We're hoping to expand our dual diagnosis treatment team to provide additional support to individuals with both mental health and intellectual developmental disabilities to gain and maintain community tenure. Develop a forensic rehabilitation center to divert or step down individuals with multiple needs from entering prison or remaining incarcerated. And finally, to develop a mobile competency restoration program to allow for competency restoration to happen where the person is as opposed to in a facility.
Fiscal year 23-24 Human Services block grant budget. The fiscal impact of the budget will be $50,229,572 and is allocated across all the programs. The fiscal impact for mental health is estimated to be $38,912,248, accounting for 77% of the Human Services budget. Intellectual and developmental disabilities, $7,843,449, that are accounting for 16% of the total budget. Drug and alcohol, $2,005,281, accounting for 4% of the budget. Homeless assistance, $957,997, accounting for 2% of the total budget. And Human Services Development Fund, accounting for $510,596, accounting for 1% of the total Human Services block grant.
And finally, our commitment, Delaware County Department of Human Services is committed to addressing the social service needs of county residents in an inclusive and equitable manner with a holistic, trauma-informed, cultural competent, fiscally responsible approach designed to meet the statutory mandates of the respective program offices. Before opening up for questions, I just want to say every year when we do this, it always amazes me how much we've accomplished during a year and also how much we still need to do the next year coming up. And the other thing that struck me with hearing everything we've accomplished this year is just the collaboration among not only the offices within Human Services and those under community support, such as libraries, COSA, or aging services, housing, community development, and so forth, but also across the county with our other offices, whether it be the courts, the district attorney, and other folks at the county level, and the courts and elected officials that we've worked with over the year to really approach everything from a county perspective and providing services in a holistic manner. I have to thank County Council for their support of our efforts. If it wasn't for them, we wouldn't be able to do anything that we're doing. So they've been fully supportive. And again, I just want to thank some of the offices that we've been working with, and especially our district attorney, who's been at the table at a lot of these initiatives to divert individuals from prison. Finally, I can't do this meeting without thanking our leadership team, which is all before you, and some of those in the audience as well. And also the staff that work with the cases, work with the clients, work with people in our system, and are really doing the day-to-day work. And none of this would be possible if it weren't for all the efforts of every single person in Human Services. So I just really need to say thank you to everybody in the department as well as at the county. With that, I will open it up if anybody has any questions or comments. All right. Seeing none, I believe we're done. Thank you very much for attending.
Make sure there are no emails.
Oh, I'm sorry. Are there any email questions?
No.
All right. Well, thank you. So with that, I want to just say thank you for everybody who's attended in person, who is watching this virtually, and have a good evening.
Thank you.
Thank you.